I'm based in Chicago at a large academic center on the south side of Chicago. Um, uh, the infection has really ravaged through Illinois and Chicago in particular, which is by far its largest city. We're still seeing increased diagnoses of COVID-19. Of course, we're also testing more patients. Fortunately, our hospital, although quite busy with many quite ill COVID-19 patients, has been able to cope. We haven't run out of ICU space or ventilators, for example. Our administration has been really, I think, fantastic in organizing our response to the infection, so that I think has limited infections amongst healthcare workers. So kudos to them. It certainly has impacted my practice and the practice of all the oncologists here markedly. Initially, we were deferring a lot of our clinic appointments except for the sickest patients and those on treatment. Over the past 3 or 4 weeks, we've really picked up on telemedicine, video medicine, which was totally new to us. Probably something that would have been rolled out eventually over the course of a couple of years, was rolled out over the course of a couple of weeks. And so we're rapidly trying to learn how to practice medicine and oncology in particular in this new era. I do imagine at some point, months or years from now, when hopefully COVID-19 is behind us, that the pandemic will have had lasting effects on how we practice, particularly with regard to virtual medicine, consults, return visits. I think patients, particularly those that are doing well or those that want a second opinion but are living far from the center, would prefer it in particular. I don't absolutely love it, and I would not want my practice to become a telemedicine practice. There is something to be said for looking somebody in the face who's sitting across from you, examining them. There's certainly less real human interaction that occurs in a laptop based or iPad based approach to medicine. But I think it is here to stay to some degree.